A Scottish charity is currently working in Nepal to try to improve access to healthcare in some of the poorest parts of the country. EMMS International has funded their first ever specialist palliative care nurse. As well as providing help for those reaching the end of their lives, they're also training other medical professionals. In the first in a series of special reports, our reporter Susan Ripple has been to meet her in the shadow of the Himalayas.
These small steps mean the world to Pabitra. For the past 5 years, she had been bedbound after sustaining a spinal injury following a fall. But thanks to the help of this nurse, she can now make the short walk from her home to the hospital for a physiotherapy appointment.
I was afraid of what would happen to me, and I was afraid of how my family would feel. Now I feel much better, and it's good to be able to walk to the hospital and leave my home. My daughter is very happy. She says, "Mummy is getting better. She's well now." If my daughter's happy, I'm happy.
Manju has been working at the Mission Hospital in Tanzania for the past 3 months. She's the country's first specialist palliative care nurse, a position funded by the Edinburgh charity EMMS International. Nepal is vastly under-resourced when it comes to providing help with serious illnesses and conditions. There are just 10 centres providing palliative care, only one in rural Nepal. A staggering figure, as more than 80% of the country's population lives in these remote areas. Here, Manju is explaining to this man that his mother is too frail for aggressive surgery, advising him the best course of action would be to end the life support. 2 hours after filming, she died.
When we know that patient is not going to improve, it is really hard to tell them what will be the outcome. But the simple thing, when I see even they are in the suffering stage, they are in that critical stage. If you can bring the smile on their face, I think that is the big thing. They trust me. They trust palliative care.
Manju has not only helped Pabitra physically, but also mentally. Pabitra's husband left her after the accident. Her mother could only watch as her daughter fell deeper into depression. She still feels guilty the family were unable to afford the healthcare Pabitra needed.
She was in bed for a long time and I couldn't offer her treatment, so I felt sad. Now I'm very happy, and now that she's able to walk around, I feel positive.
Manju has now finished her placement here and is moving on to Kathmandu. As the interview came to an end, Pabitra said her goodbyes. An emotional time, showing her gratitude to a woman who listened and cared. Susan Ripple, STV News, Tanzania in Nepal.